When nothing works for your acne, when you've tried antibiotics, benzoyl peroxide, the pill, and your skin still won't behave, your doctor might offer you a miracle pill called Spironolactone. And it sounds like hope. But what if I told you almost 1 in every 2 women on Spiro experience side effects? And the most common ones directly mess with your hormones. And here's the part most derms don't warn you about. It can take months to work. So before you say yes to that prescription, you need to hear this, because today I'm breaking down the real side effects of Spiro and what you can do instead if you actually want clear skin faster. Hi there, my name is Cheryl Woodman. I'm a scientist, acne expert, and award-winning skincare formulator, here to help you get back to your clear, calm, confident skin. So way back when I was struggling with acne, I actually found my doctor was a bit of a stone wall when it came to helping with my breakouts. I was even told by a pharmacist that there was nothing that could be done. I would just have to accept and live with it. So I was absolutely devastated when I heard those words. I was literally fighting back tears before he finished that sentence. But now Spiro is becoming a much more common prescription for acne. And after the doctor tries you on prescriptions of things like benzoyl peroxide, like Hijack, or the pill or antibiotics, if none of those have worked, their next offer will likely be Spiro. So Spiro is a medication that was actually never intended to treat acne. It's a bit like how my husband's t-shirts were never intended to be a nightie, yet they make such cozy nightwear, especially if you're away from home and you happen to have forgotten yours. Anyway, the truth about Spiro is that it's a medication for treating high blood pressure, and it has what we call off-label use for acne. Now, this is a thing with medications. They usually have way more than just one effect in the body, and that's true for Spiro too. So see, Spiro doesn't just help to lower blood pressure, it actually is also an androgen blocker. That's how Spiro can help reduce symptoms of acne. But it comes with risk of key side effects every woman should be aware of. And one of them affects nearly 1 in 4 women. So let's dive in. What are the must-know about side effects of Spiro? Well, as you might imagine, there haven't been a lot of significant studies on Spiro for acne because it was never intended as a treatment for acne. Many studies use just a few people to draw conclusions, which is why this study, published in the International Journal of Women's Dermatology, which looked at 110 women taking Spiro for acne, is so amazing. And by the way, it's doubly amazing because so many of the studies that prove things in science, like if Spiro can be effective for acne, are often just tested on men. There's a lot of sexism in scientific research, and it's only just starting to change. So this is actually a really amazing study. What's even more amazing and helpful for us today is that this study gives a major expose on the side effects of Spiro for acne. So let's start off with the executive summary before we dive in, because I know you just want to get to the bottom of this and start healing quickly. So read this with me. Side effects were frequent and experienced by 51 patients. So that's a 46% chance you'll experience side effects when taking Spiro for acne. So almost 1 out of every 2 people will get side effects on Spiro. And sometimes they impact your life so much that people just stop taking the medication. Okay, so there are many, many possible side effects of taking Spiro for acne. I'm going to flash these up right now so you can pause and read through them if you want to, or grab a screenshot. But right now, I'm going to focus on the 6 most common. And you might have already picked up on a big side effect from taking spironolactone for acne. Spiro is super likely to upset your monthly cycles and make your period go a little bit wonky. Funnily enough, when I work with women to help them get clear, confident skin naturally, I use symptoms like these, like spotting or heavy periods or irregular periods, to understand what their exact hormone imbalance is. So the fact is, for many women, Spiro is upsetting their natural hormone balance. This study tells us that in total, 34 patients experienced menstrual side effects. So you might look at this table and think, hang on, those numbers on the right add up to more than 34 patients, and you're spot on. So that's because some women might have experienced both breakthrough bleeding, so spotting, and irregular periods. So can you spot what is the most common side effect when taking Spiro for your acne? I bet you already clocked that. It is spotting, basically starting to bleed when it's not normal for you to bleed. That might be halfway through your cycle, or you might start spotting a week before your period. Roughly about 23% of people taking Spiro for acne will experience spotting. So if that shocks you, give this video a like so more women can become aware. And if you're on Spiro right now and thinking, wait, that's happening to me, stay with me. So Spiro can cause spotting because it's changing your hormone balance. And spotting is just one signal that your body can send to you to say, hey, yes, you, hello over there. I'm not happy about your hormone balance. Something's wonky, and I'm going to give you symptoms until you fix it. In fact, acne is a symptom that can be happening for the very same reason. Your body trying to tell you something's not quite right for you as an individual. That's why my approach is to heal the root causes of your acne instead of covering them up with spironolactone. So you now know the most common side effect of Spiro for acne is spotting. The second most common side effect is a tie between your periods stopping completely, that's what we call amenorrhea in science, and lightheadedness or dizziness. So the second one we've already covered, the why behind Spiro changes your hormone balance. And that's why for around 6% of women taking Spiro for acne, their periods can stop completely. This is why I wouldn't ever personally recommend Spiro as a medication to someone who is a teenager or even in their early 20s. That's a really, really important time for your natural cycles to get themselves sorted out. Taking a medication that interferes with your natural hormone balance so soon is like using a feeding tube instead of actually eating yourself. It might be quicker, but long term your digestive system gets very upset about that. But let me also be clear, I'm not a fan of this type of hormonal hijack at any age. What I am a fan of is balancing your hormones naturally. If that sounds like the help you're after, make sure to click subscribe so you never miss a video. Okay, so first side effect is spotting, second is your period stopping, and then there's this third one, dizziness or lightheadedness. So I bet you've already connected the dots, right? Spiro is a medication used to reduce high blood pressure. So if you don't have high blood pressure, your blood pressure might get too low. That means you may feel dizzy, lightheaded. Some people also report this as feeling really sleepy all of the time. You're doing so well taking all of this in, and I know this can feel like a big decision. And by the end of this video, you'll have a better way to balance your hormones, I promise. Okay, so let's whistle through these next three side effects. Side effect number 4. Well, actually 4, 5, and 6. They're all joint ties. So see here, we have irregular periods, breast tenderness, and going to the toilet a lot. These first two symptoms are also due to the hormone interruptions Spiro can cause. And the last common side effect, going to the toilet a lot, well, that's because of how Spiro works as a blood pressure medication. You would actually expect this to be the case. And that's because Spiro works by being a diuretic. So it stops your body from retaining water, so the pressure in the blood vessels drops. Less fluid in the vessels means less pressure. It's like fixing a leaky sink by just draining out all of the water. So Spiro can make you pee a lot because it's a diuretic. So the 6 most common side effects of taking Spiro for acne are spotting, missing periods, lightheadedness or dizziness, irregular periods, breast tenderness, and peeing a lot. So many people decide to stop taking Spiro because of these side effects, just like my amazing client Megan. This is Megan when she first came to me for help. She told me that dermatologists kept prescribing her Spironolactone and that it helped a bit but never fully cleared her skin. She also mentioned that she hated the side effects. She felt dizzy often, dehydrated, and just off. She stayed on it because she was terrified of what would happen if she stopped. Every time her derm tried lowering that dose to try to get rid of those side effects, the cystic breakouts would come back. So then Megan started working with me, following my acne warrior method. And here is what happened next. In just a few months, Megan went from medication reliance and still being trapped in this constant cycle of angry cystic breakouts to clear, calm, happy skin that is now super resilient and just healing from those leftover acne marks. So this amazing progress happened in just a few months with my acne warrior method. And because this is natural progress, because we balance your hormone levels with simple changes to supplements, diet, skincare, and lifestyle, there are some amazing side effects that you want. So a big one for Megan was that her periods came back to a normal length. Before, she had been struggling with irregular periods and really long cycles. So that's pretty amazing, right? To see that normalization. Now, I know you might still have some questions about Spiro for acne, but here's what really shocked me when I dug into the research: how long it actually takes spironolactone to work and what happens when you stop it. So that's the part most women aren't told. And I've broken that down for you in this next video right here. So go watch that before you make any decision about spironolactone.